what you expect the first few days or a couple of weeks after the surgery is really depends on the type of abdominoplasty we did and extent of the operation. Majority of patients, they might have nausea for first 1 or 2 days. Pain is very common, especially the first 3 days, and gradually it will come down. Majority of patients that require pain medications, whether narcotics or some anti-inflammatory medication. Bruise is very normal, and sometimes they get bruised and usually lasts for a few weeks before they go away completely. Swelling is also very normal after the surgery. The amount of swelling is also related to the extent of abdominoplasty and whether it's combined with liposuctions or not. Inability to sleep, because we want them to sleep in a reclined bed, so they can't lay down completely, so that limits their ability to lie down, and because of that they have a little difficulty sleeping. Some patients also would have a little difficulty with because I ask these patients to sleep in a reclining position with multiple pillows behind their back. It's a little bit difficult for them to go to sleep because they have a difficulty moving from side to side also. Therefore, inability to sleep is very common after the surgery, for especially the first few days. They will also have some bloating and constipation. That's also very normal because of lack of mobility and taking pain medications. What we need to expect after the surgery is a steady but a slow recovery. So that might take at least a week to 2 weeks for them to recover from these initial problems. But as far as the results, normally it takes between 3 to 6 months, depending on the extent of the abdominoplasty, and again whether it's combined with the liposuction or not, before they can see the final results of their abdominoplasty. The first night, I would like them to have a very light dinner with plenty of fluids. I want them to take a deep breath and also ambulate and move around. Patients after these type of operations, they have a high risk of developing blood clots in their leg or developing respiratory problems like pneumonia. And it's very critical for them to walk as much as they can and also take deep breaths. They need to take their antibiotics and anti-inflammatory medications, which again is going to be prescribed to them prior to the surgery. And we want them to have and I usually see these patients one day after the surgery, and then weekly, every week. Obviously, if they have 360-degree liposuction with the abdominoplasty, because they need to have drainage, frequent drainage. I usually see them more frequently during the initial weeks of post-operative care. These patients, they need to take care of the drain. The drain is the plastic tube that we put in to suck out all of the extra fluid that they develop, and usually that stays between 1 week to 10 days before I remove them in the office. And they need to keep that clean and do dressing change daily. They can take a shower and wash their wound with the soap and water, and then put their dressing back on and put their compression garment on. The compression garment needs to be on them for 24 hours a day, other than during the shower. Obviously, they take it off, shower, and put it back on. They will have drainage sometimes around the incision or around the drain, and that's very normal. The first few days, it happens most of the time when you put the pressure garment on. And again, if the patient had liposuction with it, they have more fluid coming out from the drain area when they shower or change the dressing. So the recovery usually depends on the type of abdominoplasty that they have, the extent of the abdominoplasty, and also whether it's combined with liposuctions or not. And majority of times the final results would be between 3 to 6 months after the surgery. The first couple of weeks they would have pain and discomfort, and gradually will go down. They will have just a little soreness up to 6 weeks, and majority of patients, they would not have pain after the 6 weeks. They would have some changes in the skin sensation. Majority of patients, they complain of numbness, which usually go away after a few months. The bruise usually lasts around 3 weeks before it go away completely. During the 3 to 6 months, they usually will see on and off swelling in the abdominal wall, and sometimes it's not even, and it's not in just throughout the abdomen. Sometimes it's just one-sided and create an unevenness in the area, especially around the incision area, which usually again go away after 3 to 6 months.